I'm a leukemia physician for 17 years. And my practice, 80% of my patients in the largest leukemia program in the world is based on clinical trials. And these clinical trials are good. They're very important. They are roadmaps. But I felt that they were very rigid. And sometimes the inclusion criteria, in my opinion, or exclusion, did not make any sense. Why would you exclude someone on a clinical trial that had a little bit of an impaired renal function when the drug is metabolized by the liver? Or why would you not allow a patient a trial because he's not strong enough or walks enough during the day? Or you had cancer 2 years ago, these kind of things. So that criteria to me looked like it was there more to protect the study drug, not that anybody has any bad intentions, but to protect the patient. Indeed, actually, if you think about it, if you were a patient had some other cancer, now you have leukemia, and you have a little bit of kidney failure, liver failure, that's the patient that in a way will benefit the most from this type of intervention, because if you're totally healthy, why would you go into a clinical trial, right? I will think about this. So to test this, we did a number of years ago a pilot trial where we did what I call the anti-trial. So to go into this trial, you have to have the reverse criteria that will allow you to go into a regular trial. So you have to have impaired renal function or impaired liver function or very poor performance, or have some active other disease, like in our center, cancer. But in this trial, we treated patients with dementia. And you will say, is that ethical? I don't know, but the family wanted to treat the patient. I know this will be, or patients with advanced metastatic breast cancer, or very bad heart function. I mean, I'm not the one who will make that decision. That was a recommend. And what we saw is that we learn as much from that population as from the healthier population. So there is no, in my opinion, reason to restrict those studies. And actually, those patients benefited a lot from the therapy. Indeed, probably relatively more than what will be the healthier counterpart. So to me, this is a very important study. To prove that, then we expanded to an additional, I think, 60 or 70 patients to see if this was true. And we saw exactly the same signal. So I would like people to take notice of this, both the government, like the FDA, and the pharmaceutical companies, because this has become a little bit like religion now. You have to put this criteria in your trials. And half of them, in my opinion, probably are not really appropriate. I'm not saying they don't make sense. We just need to know how to use them. If we change this a little bit, probably we'll be able to improve rate to access to clinical trials significantly.